Hi there, my name is Vicky Price and this is my colleague Dr Daniel Gumroa. We're both consultants in acute medicine and we work within ambulatory care within Merseyside. We're doing this short video clip today just to talk to you about ambulatory care and how you can utilise it. So what is ambulatory care? Well, basically it's an emergency service for patients who traditionally would have been admitted to hospital, but we can actually see these patients in our ambulatory care unit. That means we can get investigations, do treatments and do blood tests and sometimes get specialist reviews that still allow the patient to go to the comfort of their own home each evening. For both services, the best way to access this service is via the phone line. And we would make a little plea to you to sort of think about patient expectations. Some patients can come in and get seen very quickly. Within a few minutes we can see them and turn them around. But for a lot of these patients, they spend the whole day within the unit. We think this is a fantastic service. They often get all these things done, the investigations and the treatments and specialist reviews within that day. But obviously from a patient expectation point of view, they need to know that they may be in our unit for the whole day.
Regarding the conditions that could be referred into ambulatory care, there is a list on the screen here of the sort of regular sort of patients that we get to see. However, it's important to note that we can't cover all patients on a single list. The main message here is, as experienced clinicians, if you feel a patient can benefit from ambulatory care and they're hemodynamically stable and likely to go home, please feel free to have a conversation with us about referring them in to us.
So, like anything, there is a few differences between the two sites. So, to be specific about the Royal Liverpool, our hours are between 8 AM and 8 PM. So, we don't take many patients after 5 o'clock, so the important thing really is to try and get our patients into the unit as early as we can in the day. The best way to access our service is definitely via the phone line. But we have had feedback to say that we understand that sometimes you're seeing these patients at a weekend or after 5 o'clock. So as a team, we've made it available for yourselves to ring our AMU reception, which is this number here, and you can ask for the consultant on call or on duty on the unit. The reception staff will then go and get one of us and we can have a chat to you about plugging the patient into our ambulatory services. If we are busy at that particular point in time, we will call you back as soon as we can. The exciting news is that we're now working on setting up an electronic referral, so you'll be able to directly refer your patients into the ambulatory care unit, and watch this space for more news on that.
The Aintree unit is open from 9 o'clock in the morning to 11 o'clock in the evening, Monday to Friday, with consultant presence from 9 o'clock to 9 o'clock. It is a newly built and refurbished unit. However, our waiting room does have a few issues, as it is quite small and away from the nursing and clinical staff, and therefore it is important for us that our patients are actually self-caring or have someone there to look after them, particularly if they're confused or need nursing care. The referral process is also via UCD, and over the last year we have worked to streamline this process. There is an option very early on in this process to speak directly to a consultant to ask for advice regarding admission avoidance. And also the option then is whether you feel the patient is suitable for ambulatory care. Obviously this is still a process that we're trying to improve, so therefore if you have any suggestions of how we can improve this further, please feel free to get in touch.
So there are a few things that we can all do to help the patient journey. Please do utilise the phone line or the mode of access that we recommend. We've had several patients that come in, they get moved straight into an A&E department where they wait for hours before we actually get them, which is adding several hours of waiting time that the patient doesn't actually need. That also means that we can streamline the right patients to the right place, which really helps. We also would like you to think about unnecessary ambulance transfers. For those patients that don't clinically need an ambulance, if we can use alternatives, that's really helpful, because there's often a delay with getting the ambulance for the patients, and they end up turning into the hospital quite late in the evening, and we know this is not good for a patient journey or a patient experience. So that leads into the next point really, is if you're seeing a patient later on in the afternoon or the evening, is there any way that you feel this patient is stable enough to wait for the next morning? They'll get a much better experience if they come into hospital earlier on in the morning when everything is open and everything is available. As I've said before, it's important to prepare patient expectations. They're not just coming for a hot clinic appointment. This is an emergency service. So if they bring things with them to help pass the time, that can help. We do both have hospital-specific patient information leaflets available, and if you'd like some of those for your practices, by all means get in touch with us and we can help with that. This is a relatively new service and it's developing all the time. We're here to help your patients and you, so please tell us if you've got any issues or suggestions or things that aren't working so well, because we really need to hear that so that we can improve it for patients.
And here are our contact details, and also from further background information, if you'd like to, the Ambulatory Care Network gives a, via the website below, gives a useful background information.
Thank you.